At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. Allergies are conditions in which the immune system exhibits an abnormal reaction to a foreign, typically harmless substance that is called an allergen upon entering the body. Upon exposure, allergic individuals' immune systems mistakenly identify these allergens as harmful. As a result, their immune systems react by causing inflammation in the skin, sinuses, airways, or digestive system. Given that people's immune systems differ, the number of allergies one may have can vary. Take note that even the level of severe allergic reaction differs. Here's an overview of the common types of allergies. Food allergies. Common food allergens include peanuts, tree nuts, milk, eggs, fish, shellfish, soy, and wheat. Symptoms can range from mild to severe. Drug allergies. Allergic reactions to medication can occur with any drug, but some are more common triggers like penicillin and sulfur drugs. Environmental allergies. These allergies are triggered by substances in the environment, such as pollen, dust mites, mold spores, and animal dander. Symptoms often include sneezing, runny nose, itchy eyes, and congestion. Insect sting allergies. Allergies to insect venom, particularly from bees, wasps, hornets, and fire ants, can cause localized swelling or, in severe cases, anaphylaxis. Contact allergies. These occur when the skin comes into direct contact with an allergen, leading to a condition called contact dermatitis. Common triggers include nickel, latex, and certain plants like poison ivy. A skin allergy test is a fundamental procedure in diagnosing allergic conditions. It involves exposing the skin to various allergens and observing the reactions. The results of these allergy tests are crucial in determining the next steps in patient care. However, interpreting these results can be complex. This is where our allergy skin test results chart template comes into play. It simplifies the process of recording and understanding the outcomes of an allergy skin test. This allergy skin testing template is meticulously crafted to cater to the needs of healthcare professionals. It provides a clear and organized framework for recording the allergens tested, the reactions observed, and any additional notes relevant to patient care. The allergy skin test results chart template is an essential tool for healthcare professionals. Here are the steps. Prepare the patient. Explain the procedure to the patient, ensuring they understand the purpose and process of the allergy skin test. Obtain informed consent before proceeding. You can also customize the tool to indicate the specific allergens to be tested. Administer the test. Perform the skin prick test, in which the small amounts of potential allergens are applied to the patient's skin, typically on the forearm or back. To avoid cross-contamination, a separate lancet will be used for each allergen. Monitor reaction. Observe the test sites for reactions. Typically for 15 to 30 minutes, note any allergic reactions at each skin prick testing site, such as redness, swelling, or other changes. Record results. Use the allergy skin test results chart to record the size and description of reactions for each specific allergen from the skin prick test you did. Include any relevant clinical notes. Interpret and plan. Analyze the results to identify specific allergies. Generally, a positive reaction will be the presence of a wheal or itchy raised red spot. Discuss the skin test findings with the patient and develop a management plan, including avoidance strategies and potential treatments. This template is a valuable resource for accurately documenting and interpreting allergy skin tests, aiding in effective patient care and allergy management. Allergy skin test results reveal a patient's sensitivities with accurate scoring essential for diagnosis and treatment. A positive reaction is indicated by a raised bump and a flare. Typically, a wheal 3 mm or larger than the negative control is considered positive, though this threshold can vary by clinic and allergen. Here is a sample of our allergy skin test results to give you an idea of how you would use it in your practice. To discover more of our free templates, explore our templates library, which you can find on our Carepatron website, linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free, just click on the link in the description. If you enjoyed this video, don't forget to press the like and subscribe button for more content like this.